Inside this displacement camp in Port Sudan, a young mother cradles her daughters and makes a choice. She says most women in her community never had. Amid war and uncertainty, she refuses to allow her child to undergo female genital mutilation, despite deep rooted social pressure. She says protecting her daughter's future is more important than tradition, even if it means standing alone within her community.
أنا من درمان.
I was uprooted from Omdurman and I live in this camp for almost 3 years. I don't believe FGM can be a tool of protection, and my husband supports my decision. I wish all mothers to stop this negative practice that harms girls in all of their life stages.
Female genital mutilation is the practice involving partial or total removal of the external female genitalia. Medical staff say they continue to witness the physical and emotional consequences of FGM. They report treating girls and women with infections, complications during childbirth, and long-term pain that could have been prevented. Health workers said that years of awareness campaigns have shifted attitudes, but the conflict in Sudan has disrupted outreach programs, closed the schools, and strained medical services, limiting safe spaces where families once received education about the risks of FGM.
I'm the head of the Red Sea Midwives School. We never teach FGM to midwives in the curriculum. It's an illegal practice that is done in the dark by the families and the midwives in a very unhealthy environment that could lead to serious health complications, including bleeding or even death. And if the child survives, she can face serious risks in other stages of life, like pregnancy and childbirth. This wrong practice needs collaboration and strong laws in order to be stopped, and we are continuing our campaigns and fight against it.
Doctors say the lack of consistent information is fueling a resurgence in the controversial practice. With communities displaced and social services stretched thin, misinformation is spread more easily and harmful practices can return unchecked. Healthcare workers stress that ending FGM is not only a medical issue, but a protection issue, one tied to education, stability, and women's rights. Without sustained investment, they warn, the progress made over decades could be reversed.
We've seen a surge in practice after years of conflict. Some families believe FGM can be a means of protection for their daughters in conflict zones from sexual violence such as rapes, and also in IDP camps. The insecurity and the lack of awareness are exacerbating the issue, despite that we continue to talk to local communities to raise awareness, but absence of law enforcement in such a fragile situation is making more families practice FGM again.
The theme of this year's International Day of Zero Tolerance for Female Genital Mutilation is toward 2030, but the UN says eliminating it by then will require stronger alliances between governments, civil society groups, and local leaders, especially during times of crisis.
Advocates argue that protecting girls cannot be postponed until conflict ends. For mothers choosing differently, the decision represents a quiet act of resistance and hope. Campaigners say every refusal helps build momentum toward a future where girls grow up free from harm. Naba Muhiddin, CGTN, Port Sudan.